Hi, I'm Henry Acosta and welcome to Health Professional Radio. Our guest today is returning, Matthew Cherian. Matthew is the Managing Director and CEO of Global Health Limited. He's been in the tech industry since 1981. Global Health Limited is the leading provider in digital health solution in Australia. We're here to talk about the health system in Australia and how important it is to have an organized, quick, and reliable network when it comes to sharing information with regards to your medical history. Global Health Limited has partnered with HealthKit to provide that very service. Welcome to the show, Matthew, and it's a pleasure to have you back on board.
Thank you very much for having me, Henry.
It's a pleasure. And can you tell us a little bit about yourself and what you do right now for Global Health Limited?
So I've been in the health industry since for too long, 35 years, in the early 80s when I graduated in IT and IS, and have been involved from day one in software development for a variety of industries. And then we started getting into health in about 25 years ago in the early 90s. And right now, that's all we do. We just write software applications for the healthcare industry. And I'm the managing director.
Yeah, and what inspired you to getting into health-related kind of work?
Well, the attraction of healthcare is, funnily enough, the fact that it is so slow and so hard, very difficult. It's very slow to take on new things. And I think that's a result of the culture in healthcare where, lives can be lost with mistakes. So the whole culture within healthcare is very much to be one of caution, which means that it's been very, in my view, very slow to take on the benefits of technology as far as information flow goes. Mm-hmm. And there's always a huge demand, for more beds, more nurses, better machines. So there's always demand for limited resources in health, and yet it is probably one of the most information-intensive industries. So it really, I think, technology can radically change the pressures that we currently feel in health. Yeah.
Can you tell us what the goal of Global Health is with its partnership with HealthKit?
Okay, so our overall goal is really putting the patient in the center of the healthcare system. I think it's fairly important that consumers, you and I, as patients or as consumers of the healthcare system, participate with the people that can help us live well and manage our conditions, whatever they are. The key to this, I think, is the ability to share data across the multiple people that are involved in our healthcare. So healthcare is not just about, sick care or treatment of symptoms. Involves, surgeons, GPs, rehab doctors. But increasingly, the challenges facing healthcare are due to lifestyle diseases, what they call lifestyle diseases. I think 1 in 3 or 2 in 3 Australians have got lifestyle diseases. That means these are conditions that stay with you for the rest of your life and need to be managed. Typically it's diabetes, mental health, high blood pressure, and increasingly, renal disease. So, and to manage these conditions requires a variety of different healthcare providers. It might involve dietitians, psychiatrists, endocrinologists, depending on obviously what the condition is. But it's generally accepted that there are multiple people that are involved in managing our condition and allowing us to avoid having to go to hospital or something more serious. So for that to happen, these multiple people involved in our care have to have access to the big picture, the total picture when they need it. And that's why secure messaging or the ability to sort of share data across people involved in my care is kind of fundamental to being able to take the next step, which is get some, significant patient safety and patient improvement outcomes.
How can HealthKit benefit the medical workplace, and how can it benefit the regular consumer?
Yeah, well, HealthKit is one of the faster growing cloud-based apps out there in Australia, and they tend to have customers across the whole ecosystem of health, allied health, specialist GP. So they have a variety of, they claim 15,000 organizations. And, by adding secure messaging to their customers' capabilities, they should be able to share information a lot easier with hospitals and rehab and aged care homes. And even the new trend is healthcare in the home, which, requires data to be flowing across all the providers, whether you're in the HealthKit network or not. And, despite their considerable market share, healthcare is probably a lot bigger than what they can ever aspire to cover.
What do you think is the biggest misconception that you usually face with regards to HealthKit and with regards to Global Health Limited?
Yeah, I don't know about HealthKit. HealthKit's not really best to direct those questions to Alison. I think it was, the big credit to those guys. They were very easy to work with, very responsive, very keen to sort of react to what their customers wanted, which is basically the ability to share information with other providers. And in a very encouraging relationship we have with HealthKit.
What's the main takeaway message that you'd like to leave for our audience today?
Well, I think secure messaging is, the government and the College of General Practice, they're all focused very strongly on the need to get digital data flowing. There's about 1 billion pieces of paper that flow through healthcare, ranging from orders, results, referrals, progress notes, prescriptions, claims, and etc. And, a very, very small percentage of that is flowing electronically. There's a huge wastage in the amount of data that gets rekeyed or scanned. Estimates are that about 30 to 40% of the cost in healthcare is non-patient facing. In other words, administrative stuff that lends itself to automation. And in Australia, with 160 billion spent on health, that's $50 or $60 billion a year that it could be better spent if we adapt technology. And just from a productivity perspective, it's a huge benefit. From a patient safety perspective, the college, Royal Australian College, has got a paper out which talks about how a secure messaging is vital to preventing death and adverse patient outcomes. So from a patient safety and from a continuity of care perspective, it is really important that digital data is flowing across healthcare. So the takeaway is that we really need to sit back and think about how we do things in the rest of our life, whether it's booking tickets or finding a restaurant or buying goods, and start applying that to the largest industry in the world, which is healthcare.
I see. And to anyone interested in Global Health Limited or HealthKit, how can they find you or how can they reach you guys?
Well, the web's probably the www.global-health.com is how they can reach us or call us on 0396750688, and HealthKit, www.healthkit.com would be the best place to start.
Awesome. Well, thank you for the interview. It was a pleasure having you back on the show, Matthew.
Thanks, Henry, and thanks for taking the time. Cheers.
Cheers. And again, that was Matthew Cherian. Matthew is the CEO and Managing Director of Global Health, and we just finished our discussion about their collaboration with HealthKit. I'm Henry Acosta, and you're listening to Health Professional Radio. If you've missed this interview, you can find us on www.healthprofessionalradio.com.au or on www.hpr.fm. You can also subscribe to us on iTunes and SoundCloud.